visit Professor seminar organized by Master of Health Promotion Program, Faculty of Public Health, Universitas Diponegoro. This seminar is conducted in a hybrid format with participants joining both on-site at Smart Class and online via Zoom. Today, we will explore the topic utilization of big data analysis and artificial intelligence in health promotion with Associate Professor Dr. Roshan Kumar Mahato, an expert from Konkan University, Thailand. Before we begin, allow me to introduce myself. My name is Alda Zika. I will be assisting as your Master of Ceremony in today's season. Yeah, how are you all doing today? I hope everyone is in good health and high spirit, and I hope all the participants can engage or participate actively, especially in the discussion session later. Today's seminar will begin with an opening remarks delivered by uh, Vice Dean of Academic. And then we will have the main season on utilization of big data analysis and artificial intelligence in health promotion. After the presentation, we will have a discussion and Q&A session for participants to share question and insight. We will end the event with a closing session. Before we start to the main agenda, let's hear an opening remarks from Vice Dean of Academics on behalf of Dean of the Faculty of Public Health, Universitas Diponegoro. For Ibu Dr. Sriwinarni, time is yours.
Okay, thank you Mbak Alda. Oke, good morning, selamat pagi. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay, we thank you for Allah grace for the blessing given to us all. And dear distinguished speaker, Dr. Rosan Komar Mahato, and moderator Dr. Andes Syamsul Huda, MKes, and respected guests, faculty member and students. Good morning and welcome. It's my great pleasure and honor to represent our dean. I'm sorry, who unfortunately cannot be with us today due to other important obligation. And it's a great honor and a privilege to welcome you to Agenda seminar. And I hope this event with theme utilization of big data analysis and artificial intelligence in health promotion and can run smoothly and be successful. And this guest lecture is important due to the increasing student knowledge about big data, big data analysis and AI. And in public health, big data analysis plays a crucial role in modern health promotion by enabling the analysis of vast data sets, maybe to identify a trend and predict health risks and inform target intervention. And this approach is important because health issues often cannot be solved with simple solution as they involve multiple interacting variable. And big data analysis support health promotion through maybe identify health trend and risks, personals and target interventions, improving disease prevention and prevention maybe, and improving operational efficiency maybe. And yes, big data analysis is health promotion and by enabling the identification of pattern and trend in the large data sets, which can be used to develop targeted interventions and improve population health. Okay, so big data plays a crucial role in the supporting health promotion by enabling the identification of health trend, facilitating personalized interventions and enhancing patient engagement. So, uh, and once again, let me express my appreciation to our esteemed guest speaker, Dr. Rosan Komar Mahato. Thank you from Konkan University, Thailand, for taking the time to be here. And your presence and expertise are invaluable to our student and faculty. And thank you to Magister of Health Promotion Program for organizing this seminar. And I open this event with a speech, Bismillahirrahmanirrahim. And the last, I want to thank each of you for being a part of this event. And I wish everyone a rewarding and insightful experience. Wassalamualaikum warahmatullahi wabarakatuh. Selamat pagi.
Waalaikumsalam wabarakatuh. Selamat pagi.
Salam.
Thank you, Ibu Dr. Sri Winarni, for the opening remarks. For your information, today's participants include undergraduate, master, and doctoral student from the Faculty of Public Health, especially from Health Promotion and Biostatistics.
Yeah.
So let's move on.
I'm sorry, Mbak Alda. I'm sorry, Mr. Rosan, because I have another agenda, so I can finish this seminar. I'm sorry, I leave
Okay, no
this
problem.
meeting.
Thank you.
I'm
Nice to
sorry.
meet you.
Thank you,
Thank you.
Ibu.
Thank
Nice
you.
to meet you.
Thank you, Win.
Thank you,
Yeah.
Bu Win.
You, bye-bye.
Bye-bye. Thank you.
So let's move on to the next agenda, the main part of today's seminar, the visiting professor session. The session will be moderated by Bapak Dr. Andes Syamsul Huda Budi Mustafa MKes, Head of the Master of Health Promotion Program. We hope that all participants can follow the presentation attentively and make use the opportunity to ask questions during the Q&A session. Bapak Dr. Syamsul Huda, time is yours.
Okay, thank you, Mbak Alda. Good morning, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Welcome to our seminar, a visiting professor seminar, and welcome all students. Welcome to joining us in listening to the visiting professor seminar today. Thank you for the Vice Dean Academic Undip Ibu Sri Winarni for joining us, for opening the event this morning. Today we are connecting both online and on-site in this hybrid format. We are honored to have you all here. The topic of our seminar is utilization of big data analysis and artificial intelligence in health promotion. Together with Associate Professor Mr. Dr. Rosan Kumar Mahato, an expert from Konkan University, Thailand. As far as we know, the seminar aims to broaden our knowledge and inspire new approach in public health, especially in health promotion in this digital era. We hope today's session will be interactive and insightful for all participants. To start our program, we'd like to invite Master Associate Professor Rosan Kumar will share his expertise on how big data and AI can transform public health, especially health promotion practice, and how we can apply this insight to our own work. Then Professor Rosan, and the floor is yours. Thank you.
Okay. Good morning, everyone, all the participants, the head of department, and the dean, Honorable Vice Dean. Thank you so much for having me here today to share about the utilization of big data and AI program. So this is Dr. Roshan Mahato. I'm from Nepal, actually, and I did my master's and doctoral from Konkan University. It's long ago, so I'm associated with the Konkan University since 11 years already. Looking for my background, I have started my career as a laboratory technician. It's a very basics, and then start with the public health all. So I did my Bachelor of Public Health, Masters, and then the Doctoral of Public Health. My research field is mostly about I did in the tuberculosis, the infectious disease. So most of my thesis are in the tuberculosis and diabetes, and then I tends into the big data. In 2015, I start with working for the spatial analysis. So I start with using the big data and what are the importance, how we can integrate big data. And now onwards, like we are also using the machine learning and so on. I usually teach research methodology, spatial analysis, of course, and then the epidemiology for my master's and doctoral student in Konkan University. I also work for Nepal very long, quite a long time. It's around 20, 21 years. And it's still like working over there for as a visiting also on this few universities. So I'm really this is very good opportunity for me to share my experience and then take your expertise as well, how you are working in the big data, what you understand about the big data, what you understand about the AI or machine learning for the digital public health. What is your expertise? What is your expectation? So I am very grateful today to having all of you here for the health promotion master's student or undergraduate or doctoral student, and the faculty member, my moderator, and the MC. So thank you so much for being with me today. And then I hope within this 2.5 hours, I will try my best to share my knowledge and expertise that much I have it, and then maybe we can utilize all this my expertise together in a future to maybe get some big projects by all of our side. Then we can utilize it. So thank you once again. So shall I start with sharing my slide first? Okay. Okay, let me share my screen. Okay.
Yep.
So am I audible now? Everything okay?
Okay.
Okay, so as we are doing this, it's a hybrid course. I will love to have a good like interaction between the students and then the faculty members and myself. Then we can make it more like we can say like interactive session. So talking about the utilization of the big data analysis and artificial intelligence in public health promotion, this is a very new very good concept that has been arise, and I'm very very much thoughtful to give you some knowledge on it, what we are exactly doing. So I will love to start with some questions for the student. I will love you to participate in this session directly with me that we can talk about. So can algorithms save life or not? What do you think? In your maybe any volunteers will be perfect for me to answer this question. Can algorithms save life? If you understand the algorithms, what does it mean? So does it save life or not?
Ada, you can push your friend
Anyone can answer, no
response.
problem.
Anyone.
Yeah.
Maybe some student is shame to speak in English. Maybe the student you
No
can speak in
problem.
Bahasa and then I will
Yeah.
translate for you.
Okay.
No one.
No one. Okay, no problem. I will go a
No,
little
no.
bit further. Then maybe you will understand after that. You will
Yeah.
answer it. So I hope you will answer it. And the second question I have again, like, can algorithm prevent the disease or not? So these are the big things that we are trying to interact with nowadays. That what sort of things that can easily like we can get it, or is it helpful or not? That we are trying to make a discussion on these things. So this is how we have to interlink with why digital informations matter in public health. When we are talking about the public health, so why digital informations exactly matter? So that two question, answering that two questions, first, can algorithm prevent, like save lives or prevent the disease? That two things is the major agenda for nowadays to look for us, that we can exactly get or into it to the know about the digital informations matter in public health. So if you can see, the digital revolutions have changed nearly every aspect of the people's life at the moment. I don't know what you think, but in my opinion, or in the era of digitalization, if I see the digital revolution change nearly the every aspect of the people's lives, with the vast majority of the people feeling like comfortable navigating digital tools and utilizing technology to complete their daily tasks. So whatever we have, like what are the daily tasks we have started with, our daily routines, our daily agendas, we are like trying to use all those technology, and we are surrounded by all those technologies at the moment with this one. So that is how digital informations matter in public health. If you can see, not surprisingly, the digital transformations had a sizable, means a big impact on a field of the public health, often thought for like what we're going to look for. So we are looking for reaching the large audience and then the diverse demographics. So what we exactly utilize with this big data or the digital informations, to we can reach to the large audience in a very like a specific time frame, and in a very close matter that we can reach with those audience, and then overcoming like geographical and accessibility barrier. Now, this is a simple example that I am using the digital platform to reach you in this morning. So 2.5 hours, and this is a very easier access and geographical and accessibility barrier. So this is how we can using like the digital informations matters in public health, that we are trying to do it. And the third one is like the leveraging the real-time data for the target intervention. So what we can exactly do within a real time frame, that we can perfectly like analyze or summarize or do the gather the findings of the target interventions, that we can do it. And it is really matter because it can help us to give you understanding about the big impact on the field of public health. So that's why the digital informations matter. That's I wanted to ask you the two questions that we can really see that those two questions, how digital informations matter in public health, and that has an impact on the public health in the new area. So if you can see in the the education in the palm of your hand now at the moment, it is very easier if you think or you can utilize on those things in a matter of digital platform. So it is in your palm of your hand. So mobile health applications. So we do have a lot of applications, and those applications, all those applications, that is the data that we are talking about. That digital informations are the data for all of us. So I usually used to say to my students, the data are like flying all over the places. So we need now at the moment, we public health professionals need to track it and do the real-time interventions, which we can use for the public health interventions as well. So this is the platform that we can look for. If you can look for the gamifications techniques, so that is drive the behavioral changes. So we can do the gamifications technique. We can derive or make some algorithms that can change to your behavioral changes. That also can help for your behavioral changes, where we can do like the gamificational techniques that we can apply. Then we have a social media as a public health megaphone. Now we can see this is how we can disseminate all those our informations. We can visualize, we can try to give the try to capture a big audience, to give the knowledge, to give the all those informations that we want to tell them. And this is a big platform, like we call the megaphone. It's not only the phone, this is a megaphone that we can track, or we can give all those information. So we can share all those informations to those people that your targeted people, to give this sort of informations. So if you can see, like if we are using we are trying to reaching to the larger audience like the diverse demographics and the tackle the geographical barrier within the real time with the social media. So this things matters because we are trying to use our all those informations for the larger audience, our diverse demographics, and tackle the geographical barriers as well in the same time. So social media has proven to be like the double-edged yes world we call, with the considerable benefit as well as the notable harms as well. So we cannot say there is always a social benefit, but we do have some harms as well. That's we have to be very aware when we are using our these things like digital platform or the digital platform that in the public health, and where we are trying to give this knowledge to the large audience within a real time, that we might have some notable harms as well that we have to focus on. So it can be used to encourage the preventive behaviors and foster the social connectivity for the better mental health, enable the officials like to drive timely informations and connect the individuals to the reliable informations. So, and we can do the breaking the geographical barriers. So that is the most important part, why we are trying to use this platform, why we are trying to look for the digital informations in public health to break the geographical barriers. That is the most relevant one, enhancing the accessibility. So we want to raise to the people's hand at the moment. That's why I told you at the beginning that's mobile phone. Now all those digital things and all those data is in our palm at the moment. So if you want to really want to use that data for the public health interventions, you can reach to all those people by enhancing the accessibility to all of them. And that is a very useful and real-time information designation. So these three things is really matters in the public health when we are talking about the digital information. So before I talked about the AI, I reached into the big data and the AI classification or machine learning things or spatial analysis things. I just tends to use the what is the digital informations in public health that we can use as a big data and that we can utilize. So what are the things that we are really trying to capture on those things in between that we can really track and then promote the health of the people in a very real-time scenario. So this is the things that is always like helpful for all of us. And we can I don't know how many of you have seen the screen time of your mobile at the moment. You have checked or not? If you can check it, you can get the information about the how many hours you have used for the Facebook or TikTok or Instagram or any other social media, or how much time you can use other like the Google or some other AI or anything else. So how much time you have spent to using the screen time. And that screen time is whenever you are using that screen time, that means you have the data and the resources. Even your data is also going there, and the data from the all of the world is coming there on your palm that you can utilize in a public health in a public health to materialize the things that we are trying to evolve and aware to the larger audience of the people as well. So if you can see the social media, of course, is a powerful platform for the public health educators. So when used effectively, it can amplify the messaging and increase the accessibility significantly. So if we can use it in a good way, if we can try to educate like the public health educators, we can use it as a platform, then when we can effectively, we can amplify the messaging and increase the accessibility of those things. So we can crafting the shareable content in the health campaigns. So we can utilize this as a shareable contents to do the health campaigns. So mostly we can use for the awareness raising, or maybe like during the pandemic situation, you have seen a lot of social media, that platform that we have used, a lot of mobile applications that we have used, and those are all those sources of big data. That's why I'm trying to emphasize this part quite a little bit more, that whatever we are using in the form of the like the social media platforms or in the forms of the digital platforms, that in public health, those are the things are generating the data for us, and that data we can utilize for further interventions of the any public health programs. So we can do like the shareable things, then we can use like the influencer partnership and peer-to-peer learning. So that is also the another expertise that can matter in the digital information in public health. That is like the partnership to peer-to-peer learning that we can do. We can also do the monitoring, like the sentiment and the combining the misinformations. So that also we can combating the misinformation. So we can also like try to filter the good informations for how we can utilize those informations and further on. So if you can see, for example, like the bossing the like the flu vaccinations rate via social media in urban schools. So when we try to do with the vaccinations, like the boosting of the flu vaccinations rate by social media, then we got the result like the health educators share like the accurate vaccine information via podcast, reels, and then infographics. So these three things we utilize, and then the result comes like the 4% changes is their flu, 22% of they got the flu shot. So this is the one greater example of like how digital informations matter in public health. So, and this digital information, so what we got exactly on the basis of the, we try to focus on the big sort of the population, school population, urban school population, to reach to them by different utilization of the social media, by podcasts, reels, or infographics, that we can train them, that and then we can use their change their knowledge activities to get the more vaccine shot. So that is how we can use for the all this platform. If you can see here in this picture is all about what we can do with the digital information in public health. If you can see here, we have a watch, then we have different things we can monitor at the same time. Heartbeat we can monitor our drug like the regulations and so on. So everything what we try. So health tracking devices, now we have a wearable technology, are the big use for frequently like the healthcare providers and public health professionals. So this we can use to generate the big data, all of things that we are trying to generate the big data, and that can matter in the public health very much. So like the collecting like the biometrics data for the personalized education as well. So that is again like a big data that we are trying to generate it, encouraging the self-management of the chronic conditions. So we are trying to help them with some algorithms that the self-management. I will give you one example of my previous question: can algorithms save life? I'm not sure you have already like heard this news or not. People from one of the, I forget the name of the country, she had some chest pain, and then she tried to give her data to the chat GPT. It's very easily she tried to give her what she has, how many days, all those complaints, sign and symptom, and she got the immediate response from ChatGPT that you have to go to see doctor within 30 minutes, and it says save life actually. So that has the news came through the BBC last time. I just heard a few days ago. So that's we can do it like the encouraging the self-management and then chronic conditions as well, linking the like the wearable data to the population level dashboard. So these are the things that we can try to use it as a big data for all those tackling digital informations in the public health. So if you can see here, in this slide, you can see the like the evolving application of the digital technology in healthcare. So there are so many digital technology that has been evolved during this period of time. So if you can see here, we are doing the digital records and diagnostic dashboards, that is the health informations that we can finally get this output. So we will start with the knowledge generation. That is, we can have like the epigenetics, like the epidemiological modeling, AI, or machine learning. So that's we can do the knowledge generations. Then we have a knowledge integrators, that is the decision aid or predictive analysis by the artificial intelligence or machine learning. Then we have a personal health devices like the mobile assessment, monitoring, and trailing devices. Telemedicine, of course, you have seen this about like Indonesia or Nepal. I have not seen much in Thailand for the telemedicine, but in the remote consultations, it is very useful care management and then coordinations. That is the telemedicine. And for diagnostic also, we can do like the testing, analytical, or on-site remote site diagnostics as well, and then imaging like the pinpoint assessment and interpretation. So I will give you some example like how machine learning can helpful to the diagnosis and the prediction of the different type of disease. So if you can see like the pharmaceuticals, we can use it like the dose use or titers monitoring. So these are the some matters that how we can try to help like the digital applications to get the data source as well as use the digital technology in healthcare, like the implementation device, like we have a tracking, monitoring, targeting devices. For surgical, we have a robotics like the remote site targeting devices, and for personalized therapeutics, like we have now 3D printing for the genetic basis tailoring. Then we have a sensor, exposure, and integrators for the spatial geospatial environmental data. So now what we can do for the geospatial data, we have a big data in GE. We call the Google Earth Engine. I will give you some more example that how we can tackle those data, that big data, so that we can do the sensor. We can do the all those environmental data censoring, like we can very easily censor the data of the nighttime light. We can easily censor the data of the terrain. We can get the data of the temperatures. So, and then that data we can integrate with the another big data, that is the prevalence of disease in Indonesia, some diseases, or prevalence of diseases, incidence of diseases in any part of the world that we can integrate, and then we can find out like the very good idea from that data source. So there are so many clusters that we can handle it like, and then we can do this health informations digitalization and the recording to the dashboard. So this is the evolving applications of the digital technology in healthcare, where we have a really, this is the source of the big data that we are trying to use that big data to predict the disease or any sort of the health impact, or any sort of the health related problems. So that those things we are trying to reach with.
Terlambat.
Yeah. Yes, go ahead.
Sorry, Master Rosan.
Yes.
Would you please speak slowly, please? Maybe the student
Okay.
will have difficult to understand what you're saying, because the student here are used in Bahasa.
Okay.
They're so
That's
fast.
okay, no problem.
Yeah, okay,
Yeah,
thank you.
Okay, that's great. Thank you so much. So let me turn to the next slide. So what exactly we want to talk about in this slide? So the use of digital technology and the data in the medicine life cycle. If you can see the what exactly digital health derives, like the innovations that what we can look for. So the developing the medicine with the patient that we can doing with the digital technology, that is connecting better with the patient allow, that is greater understanding of the patient needs, that we can do well designed clinical trials, and then the patients want to participate in or enhancing the data collection during the study. So these are the things what we can do, we can making the distribution of the medicines. Also, we can do the supporting the medicine in use, and then we can also look for the monitoring of the medicine, of the patient support, and discovering the new medicines. So this digital technology or the data in medicine lifestyle, where we can try to get making the distribution in the medicine, that is enhancing the data on the product during the manufacture or distribution allow, that is maybe the automations of the inspections that ensure the safety, quality, precisions, identification, and then we have the efficient tracking or supply of the wearable to the patients, and then we might have the supporting patient care with the informations and the reminders that we can look for the supporting medicines use. So this as finally do the enabling the access to available that data allow, that is the enhancing the disease understanding and more target treatments that we are trying to get it. So that is like a novel approach is to bring the best medicine to the patient. So that's we are trying to use for the digital technology and the data in the medicine life cycle. That's we are trying to get. And the next why why should we do this sort of things? So key principle of the digital public health, if we can see, that is the data driven decision making. So all of the things what we are trying to generate or trying to the background, I just give you a small background of the concept, why digital data is important, why digital information is important in public health. To key principle is data driven decision making. So now what we can do with the artificial intelligence of the big data to use for the data-driven decision making, that we can easily do it, because we will not say like we already have a lots of research methodology that we can identify the cause and effect relationship and so on. But now what we can do, we can predict. We can predict in a good accuracy. We can check the accurate model, which we can use it for the decision making. So that is the main important things that we are trying to do. I hope this is okay, right? So we can also look for the privacy and security, of course, and the collaborations. So this is the key principle of digital public health, if you can see, and then the interoperability, like sharing the data, and equity. So these sort of things that we are trying to do mostly for the data-driven decision-making part, that we can use it. So, and the key role of the digital public health, if you can see, what we are doing everything is for to disease surveillance. Number one. Number two is health promotion and education. Number three, of course, telemedicine that we are talking about, that we can help from the like a master of health public health promotion student. You can use the telemedicine to make a lot of algorithms that you can train for the people for the behavioral change, and then health data management and emergency response. So this is the 5 major key roles there we can use the digital public health. And then we can generate the big data for further prediction and decision making of the any sort of the disease or health related event, to enhance the public health program in our circumstances. Okay, so digital public health surveillance, what we can look for, so we will usually look for the simple text that you can edit or can change, for like the data collections, that is a planning design, for the data analysis. So what sort of things like the disseminations action? So we have 5 major steps there we can do with this part. So we can start with like the planning, that is designing, then data collections, then data analysis. So where we can design by ourselves, evaluation and disseminations of the actions. So this, for these things, we need data, or we have to get all those things done with integrating the public health, digital public health system. There we can find it out. So now I will come to the end of the concept point there, how we can digital public health technology used in digital public health can help us to generate the big data or AI modeling that we are talking about. So we have a very good system, is a EHR. Now this is the source of the big data. There we are trying to generate the big data for the machine learning, or maybe we can say the artificial intelligence used to get the decision making. So we can use it for like the electronic health records or electronic medical records. There we can generate health information exchange. There we can also generate for the digital public health data, telehealth, telemedicine. So we can say like maybe we might have a data of the different people, like we can usually get maybe like, let's say, blood pressure or diabetes, blood sugar examinations, cholesterol, or so on. Now we have a mobile health data also platform, where we can use this mobile health data for the prediction of all those diseases. Geographical information system, that is one of the bigger area there we can generate and then use the digital public health, and then artificial intelligence and machine learning. So, and then we can do the block the chain. So this is the platform where how we can try, or how we can make the predictions, how we can generate the data, public health, that the student of the health promotion or public health students can use it for further into the machine learning or artificial intelligence. So any question until now? I'm just giving you a concept of like what exactly we are talking about, why we are talking about the artificial intelligence or machine learning. So where we have to be there. So any question until now?
Okay, student, you can ask or write in the chat box
Yeah, chat
using
box.
bahasa, it's no problem. Still no question. You can
No question. Yeah.
continue.
So
Yeah.
yeah, I will continue. And then if
Yeah.
we need a break, just let me know. Okay. Okay. So this is just, I'm trying to give you a concept of the digital public health, how we are trying, what we have at the moment, what we are get surrounded by ourselves. There we can utilize those things to get all those informations that we are really looking for. So let's continue with what is the AI and machine learning in public health at the moment that we are talking about, and we are trying to solve it. So if you can see, this is a very, very simple, now you can get all those things very easily, that is artificial intelligence or machine learning. So if you can see the artificial intelligence, this is like a technology that enable the machine to imitate the various complex human skills. So now what we are trying, that's why I talk you about the algorithm first. So what we are trying to do, we are making some algorithms giving to that machine that imitate the various complex human skills that can give you, or the science, and then the engineering of making intelligent machines. So now we are doing the both things that trying to do with the artificial intelligence, or if you can see, the machine learning is a part of AI, of course, study how computer agents can improve their like the perceptions, knowledge, thinking, or action based on the experience or the data. So if we do not have any data, we do not have any of the previous digital data that we have talked about, there is no machine learning, no artificial intelligence. So that's why it is very important to get the all those data first, and we have to know about where is our source of the data first. That's only we can do it. So we can do like use the computer agent, and then we will do the check their perceptions, knowledge, thinking, and action based on the experience or the data that we are trying to do with a very simple, we can say the very simple definitions, these two definitions. So is it new or is it already old? Any idea? AI, when you think AI came, when AI arrived in our surrounding, any idea? Is it very new, just right now in 2020 or 15, or any idea? Any sort of things?
Still
Okay,
no.
student, you can give the question.
Yeah, you can give, make it interactive.
Yeah,
Because
make
it's
it-
too long to listen monotonous,
yeah.
it will be monotonous. So just make it a little bit interactive. And it is a better understanding as well. Any idea?
Ya, mahasiswa silakan komentar. Nulis kalau nggak bisa, nulis nggak apa-apa. Nanti kita sampaikan ke Mas terusan. Wah,
No.
still no comment.
Okay.
Okay.
Okay. So let's see a little bit like from the rule-based system to the deep learning, how we have enhanced. So it is not new. That is my point. So earlier development of AI, it was in 1950s and 1960s. So machine learning algorithms, such as if you can see the neural networks and the decision tree, I to get like significant enthusiasms that it came. And then it was like a recent advancement in AI. So AI began to be applied in medicine, first through the expert system design to support the clinician decision, and later with the neural networks for the decision classification and segmentation. So it is not new. It is in 1950s. So it is, but it's developed right now for the first. It came like for earlier development in 1950 to 60. That is the network and decision tree only, and that forms. And then it comes to the expert system design and supporting the clinician decisions, like a lots of the cancer decisions. And now what we are doing with the neural network, we are trying to detection, classification, and segmentation as well. And then so like the initiation in the initial application in AI in the medicine, that is the capabilities of making the automated reading of the medical images and improve the AI to the new domain. And finally, like the AI potential to the medicine. So AI is one of the most promising resources for frontier research and application in medicine. So this is how we have integrated AI into the system. So it is not new, though it has continuously improved to now we can use it as a big resource, that we can use it for the research or diagnostic facilities, the predictions of the different things that improve the society, improve the social health, improve the overall public health, for to do all those things by evolution of this evolution. So if you can see the milestones in AI adoptions, what happened. So AI tool facilitate and enhance the human work, and no replace of the work physicians and other healthcare staff, such as like AI ready to support the healthcare personnel with the varieties of tasks. So what we can do, we can do the precision medicine, number one. So that is genetic information based solution, drug discovery and development. That their evolution of AI in healthcare has been act. Next one is artificial intelligence and machine medical visualization. That is the machine version of the diagnosis of the surgery or deep learning or the medical images that we have used for. And number three, we have used for like the intelligent personal health records, that is a health monitoring and wearable device that you have seen in the forms of iWatch, or in the forms of the different devices, wearable devices. Also during the COVID-19, also you have seen so many devices that we can monitor for the health monitoring devices. And then also in the four, like the robotics and then artificial intelligence power devices, that is a minimally invasive surgery or neuroprosthetics that we can also use. And then evolution. And number five is like the ambient assist living, that is smart home, assistive robot, cognitive assistant, social and emotional simulations. And then number six is uh, the artificial intelligence can see you now is artificial intelligence near and the remote. So that is the evolution, that is the milestone of the adaptation of the artificial. So it is not very new. If you can see, it's already been 75 years. There we have started this artificial intelligence and so on, but it took time to come with us. Now we can make it usable for our decision making and predictions. We are using the prediction of precision of the medicines, artificial intelligence, medical visualizations, like the integration of the personal health record, robotics, or other things that now we are trying to adopt it in the form of the healthcare providers, or in the form of the healthcare utilization. So this is the form that we are trying to use it. So if you can see like key concept in the AI and then medicine machine learning, we can see the two things. So do AI algorithm can identify the patterns and correlation? So again, this is my question. If anyone, until now, if you understand, you will give me an answer. Yes, no is enough.
Yes, we can catch you.
Yes, right? That's for sure, right? So, so if you can see here how. So we have two major things that we are trying to do. One is the decision tree that we are trying to get. That how we can do that. So one of the powerful method commonly used, we call the decision tree, are the successive model that like the units, a series of the basic tree, efficient, and then the cohesive, whether the numeric feature is compared to the threshold value of the each test. So what we are trying to do is, what we are trying to get the predictions that in a different aspect of different values of those variable which we are already been identified. Now we are trying to make the good decision on the basis of the result in the form of the decision tree to use that threshold value of the each test that we can do, or we can find out or identify the patterns and the correlations, and then identify the sensitivity and specificity of that particular algorithm or that uh, uh, particular area of our interventions. So, and then is another one is neural networks that we are already, I explained a little bit, like the artificial neural networks applications that have increased dramatically in the world, the middle of the last century, that the most well neural networks, that is ANN, CNN, and RNN. So I will talk a little bit more about all those three neural networks that we are integrating or connecting now with the AI and machine learning system that we are trying to use it. So if we can see the type of machine learning, if I go to the type of machine learning, we have actually, we can say 4, but I used to say 3, that we are trying to use it now, and then we are integrating with lots of model as well. So what you are using to do it, what software you are using to do machine learning things in your university at the moment? Mostly Python, R.
Actually, we don't implement yet the machine learning because we are from the public health, and
Yeah.
we are mostly
We are also very new.
that's very new for us.
Yeah, right.
Machine
We are
learning.
also very
Yeah.
new. We are trying to train our students, especially
Yeah.
I'm trying to train with them with the R program. So some of the decision tree, I'm trying to make them with the R program, and then some machine learning, and also we are using Colab also, and trying to help with the Python, but not yet confirmed. But our major role is now mostly we are doing with the spatial analysis. So we will try to do with the R program and then the Colab maybe. So that is we are trying to do. So we are basically we are looking for the 3 types of machine learning that we are trying to uh, introduce with the students, and then trying to help them like how they can usually develop. So we are trying to use it with the supervised machine learning, and then we in this one what we are trying to do is utilize a data set which includes the both input feature as well as the output classes or the target, which are labeled at the start of the training. So usually what we are doing with the supervised machine learning, there we do have a label data. So if we have all those information that is in the form of the label, there we can do the supervised machine learning. And then we have unsupervised, means very basically it's provided the informations about the distinct feature set which can then like feed into the supervised algorithm. So that is non-label data mostly. And then we have reinforced learning that is utilize both supervised and unsupervised. So we do have a semi supervised as well, but I did not use to include semi supervised. I used to include the reinforced learning that is utilized both supervised and unsupervised machine learning approaches. So the previously mentioned and can work synergetically. So it can work with the both supervised and unsupervised model as well. So this is the 3 basic model that we can use it to predict the further enhancement of that particular field or that particular area that we are trying to regenerate or enhance. For the deep learning, if we can see, I talked about you already about the CNN, that is the convolutions neural network. So what exactly we will do in this one, it is inspired by the visual contracts of the animal brain to imitate the visual machinery of the animal and represent the quantum leap. So what CNN can give you, so it will give you apply to implement the efficient segment of the image of the brain tumors, heart, breast, like renal, fetal abdomen, then you have a stone and epithelial tissues as well. So you can feed all those things to get better prediction. So what we will get it is the prediction, and then we have a recurrent neural networks. So where we will diagnose to process like the sequential data by maintaining the hidden state that capture the information about the previous inputs. So we will try whatever we will feed the data, and then we will try to get something back and exhibit the dynamic temporal behaviors as well. And then that's why integrating the CNN with RNN has proven effect in the video analysis, where the CNN handle the spatial feature while the RNN capture the temporal dynamics. So if you are, I'll go back a little bit of the previous slide here, before this slide. So here, if we can talk about the what we can do. So we will do the two basic things. That one is decision tree, where we can use the successive model, utilize the series of basic tests, efficient and cohesively whether the numeric feature is compared. So we are trying to compare the numeric features by decision tree. So, and then we will compare to the threshold value in each test to make the decision on the basis of what, and we will predict the further. Number one. Number two, we will use the neural networks, either CNN or RNN, or this is artificial neural networks. So these three to predict where we have to go with the visualization things. There we can predict for visual things with the spatial feature. So spatial feature is the features with the space, and we have a time, that is spatial feature, and then we will capture the temporal dynamics. So this is a better prediction of any sort of the model that we can do it with the deep learning in this all three forms of the machine learning. Then we have the artificial intelligence, and then machine learning, and then deep learnings in a healthcare system that we can do it. So let's see how AI applications in diagnosis can help now, because we already know about the some sort of the features of the artificial intelligence or the machine learning, how we can predict. So you have seen, this is the image of, can anyone tell me about this image if you have seen before? What is the image? Is about this anything? What is in your mind? X-ray, CT, MRI?
Yeah, CT scan, MRI.
Right? So you can see now what we have seen. We use these things to predict with the integrated sign and symptom of any sort of disease. Now, what we can do with the AI application, it's very simply detect the anomalies in X-ray, CT scan, and MRI that we can use. Then we will look for AI-driven tools have revolutionized with the image analysis, that machine learning model, like the excelling in the interpreting X-ray machine learning scans. And this advancement not only improve the diagnostic accuracy, but also significantly reduce the time required to analyze the image, allowing a faster decision-making to treatment enhancement. Now, I have again a question. So why we need it? Because we already did this one, right? Before, it is since 90s, I think, right? Earlier 90s or 80s, we do have X-ray or some CT came into the late 90s, MRI a little bit late 90s. But we had those things that we are making the decision. But the main problem is accuracy and time, right? Two things that we are trying to solve this issue. And another one, can anyone guess? Another one is why we are expending our time to introduce AI, because of the human error, right?
While you explain about AI and machine learning, there are 4 participants who asked in the chat room.
Okay.
I think it's important you to read the presentation, and then you can explain the question from the 4 participants. You can close the presentation for a while. First from Miranda. Hello, Prof. I'm Miranda, doctoral student, and currently writing a dissertation. The theme of AI for health promotion. Your presentation is very great and informative. Here I want to ask you about what things. In your opinion, nggak kelihatan. In your opinion, how we ensure Yeah.
Mhm.
How we ensure that AI-driven decision in clinical practice do not create new risks for patients, especially when algorithms still contain data bias.
Okay, that's yeah. Okay.
Yeah. And
Can I
second,
answer this first?
yeah, there are two
Okay, right.
questions. If at some point AI makes clinical decisions independently, who should be held responsible for medical errors? The developers
Mhm,
or instance or
mhm,
organization?
mhm,
Okay.
mhm.
Two questions from uh, Miss Miranda kita.
Okay. So thank you so much for this very good question actually. And then I want to explain a little bit. So AI is not for diagnosis.
Hmm.
Okay, I give you that is very clear answer. I hope you understand. So what we are trying to do with AI, it is not, we already have a diagnostic model, but we are trying to make this decision to predict that model is better or not. That we
Hmm.
are trying to within the, that's why I give you this example now. So you will get more. So this one, why we give this example, so what we can do with AI significantly reduce the time required to analyze the image. So
Hmm.
what we had some problem with the human error, right? The first, so that human errors, now we did not have human errors to visualize or to detect or to read that images that we have get, and then within a very short time frame we will get this decision making. So this is not for uh, the diagnosis, that there should not be the error of that part, but we will make these algorithms to feed that algorithms to the AI machine learning models, that you can predict that disease in a better accuracy. So that is the answer of your question. I hope you got it. Yeah.
Yeah. And then from Hamdan Amri Wicaksana,
Mhm.
Mr. Rosan Kumar Mato. How can we keep our ego healthy or not controlled by artificial intelligence so that we can make our bodies healthy? Thank you. That's my question.
That's the very very health promotional questions. I love this question, but it is a very difficult. I can tell you at the moment to
Yeah.
answer, because we all are surrounded by a sort of artificial intelligence.
Oh,
Even though if you are using a mobile application, you are using the computer, you are using the teaching learning materials, anything. But
mm,
what we can do, we can use it in a good way,
yeah.
not in the, like I told you earlier during the, I'm just talking about the digital public health. I told you about the, we can, if we can see the our screen time of our mobile, we can, what, how much we are utilizing our screen time for what, and what you got the knowledge that you can improve your mental health, right? What algorithms you are trying to read it, there you can improve your mental health as well. So these are the things, but we cannot completely prevent or block AI at the
Mhm.
moment from our life. That is very difficult. Yeah.
Yeah. And then from Sabrina Arifia Katranada. Hello, sir. I had a question that crossed my mind earlier. As you mentioned, it's definitely impossible to run AI or machine learning without having the data. We
Yeah.
need to collect it first, yeah. However, in Indonesia, it is quite difficult to access behavioral data. For example, with wearable device, the data is often personal and stored in application or smartwatch, not directly online. From your experience, how can such data be accessed?
Okay. So I think maybe I will answer this question after finishing my slides. Will be
Okay,
better, because we are
okay,
just the beginning of the AI now. So I will
yeah,
answer you, and then I will tell you how we can get this part.
yeah, yeah,
Okay, this is
smart,
very good questions. Yeah, very
yeah,
smart question. I
smart
really
question,
love
yeah.
it, and just make it interactive. Okay,
And then the
so
last from
yeah,
Nurrahma.
yeah.
I'm Nurrahma. How do I get permission to use data or social media platform like Instagram, such as common data? What about ethical clearance? Is it required?
Yeah. I have an answer in my slide. I will
Yeah,
I will give
yeah.
you after this. Yeah.
Okay,
Okay, so
okay.
shall I
Thank you.
continue again?
Can continue. Okay, continue
Okay,
your
yeah,
presentation.
yeah,
Thank you.
okay, yeah, that's great. Yes. So this one I already explained. So what we are trying to do, I already give a little bit answer of this slide as well, that with your question. So we are doing the predictive analysis of earlier diagnosis, that we are trying to do it. So what we're going to look for, we're going to look for the risk assessment tool, that what we are trying to do. So one of the most significant contributions of the machine learning and predictive analysis lies in ability to enable earlier detection and diagnosis of disease, that we are trying to do it to identify, to predict, like when we can detect and diagnosis of disease. So like if you have algorithms that you have feed to the machine learning model, and if you put your data by yourself, then we can predict it when you will have now when you will have some sort of the disease, the worsening of some sort of disease. So if you are stage 1 of some sort of disease, so when you will become stage 2, when you will be in the stage 3, so that we are trying to predict it by earlier detection and diagnosis of disease. So through the analysis of the extensive patient data, including the medical records, laboratory results, genetic informations, and imaging data, machine learning algorithm can unveil, interact like the patterns and identify the subtle indicators, we call subtle indicators, that may evade the human clinicians. So that we are trying to get those things. So by detecting these earlier signs of the disease, such as a cancer, cardiovascular disease, diabetes, and neurodegenerative disorders, these algorithms offer a vital advantage in improving the patient outcome. So what we're going to do for, I already answered a little bit, that is not we are trying to give like, we already know about the diagnosis when we will get it, but we will try to make the machine learning ability to enable us to earlier detections by in the form of, we might have a data in the form of the patient data, in the form of the medical records or laboratory results, genetic informations, image data, like the machine learning algorithms, that we can use it to improve those sort of the outcomes. And there we can really act as a health promoters to help them and to detect the earlier findings. Like I will give you one example for the cancer detection, or the breast cancer detection. For example, like the improve the accuracy. So AI has significantly enhanced the accuracy of the cancer detection. For example, detection of the breast cancer with mammography. So the implication of this AI are supporting system for the mammography, improve the diagnostics like the radiologist breast cancer detection without lending their reading time, and the improvement was observed for the all breast density categories and was independent of lesion type and then vendor image quality. So this is the one of the example, like how we can use the machine learning for the AI modeling, that we can helpful for this one. So how they did it now, that may be in your mind now, what how they detect it. So they use the AI algorithm, provide the score indicating the suspicion of the breast cancer, that is they have mentioned from the 0 to 100 scale. So they just feed all those images into the machine learning model, and then they got like the mean absolute AI score they identify, where like the significantly higher for the breast developing like cancer versus non-developing cancer, that is 4 to 6 years before the detections. So that's we can identify. So we have generated from this to this image has been algorithmized, put the algorithm on that one to identify this AI scores could potentially predict the future breast cancer development, indicating the utility of the AI in earlier cancer detection. So this is how the AI can use it, and we can make the algorithms that we can feed it, then we can predict it on the basis of the different diseases that we can help for. So this is, you can see in the how we can use the AI in the surveillance and vaccinations. This is a very good example I give you a little bit earlier, like how social media platform that we can use it. So we have like the social media platform, then we have a laboratories, medical facilities, center research institute, health findings, and self-assessment. So how now AI can help for this one? So if we can see like the AI power system can streamline the vaccine production, supply chain management, distribution channel, education material, and data collection based on the geographical and demographical characteristics of the target population, ensuring that the vaccine can equitably reach all individuals. Can you or cannot? I just want your simple answer, yes or no. Can we, if we can make this algorithm can help for this one, can equitable reach to all individual? It's a very basic question. Yes? Okay.
Yeah, yes.
Yeah. Okay. So this is how. So now I'm trying to give you more clear, right? Like how we are trying to use this these things that we have already learned a little bit. So if you can see that now AI in a patient care. So what we can do, like we can do the virtual health assistant with the chartboard and the symptom like the checker. So if you can put all those your symptoms like the chartboard benefit to the healthcare cardboard, so we can improvement of the healthcare quality, then improvement of the health outcome of the patient management. We can improve like the healthcare must adhere to the strict data protection regulations, and then the promotion of the patient-centered care for health equity, and then the efficient and cost effectiveness in healthcare delivery and optimization of the resource symptom checker. So what we can do the finally is an online symptom checker that we help patient to self-diagnosis of the self-triage as healthcare consumers increasingly rely on the internet for health information. So what we can do it now, what we can develop it like the being a graduate of the Masters of Public Health Promotion, what your role is, or my Doctor of Health, Public Health students, graduates, what is your role is to make the algorithm on the basis of the AI modeling that the cardboard system that we can identify by self-care, by self-triage, self-diagnosis, that also we can help for the health promotion and so on. So they improve the healthcare quality of the all of the patient care. So this is how we can use this one. The another one is very good example from the remote patient monitoring. So how we can do the remote patient monitoring by the Internet of Things that we call the IoT device powered by AI again. So we can see like the prevention of the unnecessary visits of the hospital. Why we need to prevention of the unnecessary visits to the hospital? Is hospital visit is necessary for all those disease? Is it necessary? What could we get if we will prevent them for the unnecessary visit from the hospital? What we will get? More healthier or more unhealthier people? Samudin has a very tough time to ask them and moderate me. Any idea?
Any ideas, students?
Yeah.
Ada yang mau komentar? Maybe same or another.
Okay.
Okay.
So
Continue next.
okay, I will give you some sort of the things like why we need to prevent the unnecessary visit of the hospital. Number one is very important is hospital acquired infection. In the condition of the COVID-19, can you imagine if you have to visit the hospital, if you have a very simple symptoms, and then if you are visiting the hospital where the COVID patient has been admitted, what do you think? You will be more sufferer, right? So what is now our role being a public health professions that we can use the Internet of Things device powered by AI to prevent unnecessary visits of the hospital. So that is the most important that we have to look for at the moment. The second one is that what we can do is like the smart health monitoring devices poses many significant feature that we can improve and no need to make them visit. And doctors can like the remotely check the real-time coordinations of the patients that we can do. So healthcare services are costly today, and this service help to solve this problem, which is a great evolutions in the medical field. So if we can use this IoT device that we can really generate the data, and that it will be helpful for the patient management in a very effective and the efficient way. For the student, can any of the student give me an answer of what is ChatGPT? The full form of ChatGPT now. Now it's a turn for a student now. Have you been seen the full form of ChatGPT and what algorithm ChatGPT use? Any student can answer, is okay. Not looking to your computer. Okay. Anyone?
Ayo, ada yang komen, silakan. Please, students, comment, or you can write in the chat box. Deep
Okay.
learning.
I will show this. This is called the Chat Generative Pre-trained Transformer. That is ChatGPT. So that we are using, it's very simple. We just tell ChatGPT, that's all finished. So ChatGPT has a chat. So what we can do, the generative pre-trained transformer. So it is a very simply understandable what you will get from ChatGPT. It's a very simple, very simple. This is an algorithm. It is a pre-trained transformer. So if there is not pre-trained anything, you will not get those things. So you have to be very careful. That's why the beginning I told you it is a very smart question that you asked me about can we free from the AI? No, it is very difficult. But what we have to free from to understand it in a good way, that how AI in student learning we can use it. And I'm also like teaching some of the students. Next week I have a class for how we can use AI for the manuscript writing now. But we need to still know about how this GPT can use or generate it, the excitement. So what we will do, the chat GPT for the student is generated excitement and concern in education. So it revealed that the chat GPT interventions are predominantly implemented. The university level covers the various subject area, focusing on the language. Educations are integrated into the classroom environment as per the regulations, education practice, and then the primarily involve direct student to use the chat GPT. So now I have another question. If you have any question now at the moment, so if you will ask to the internet by Google or by ChatGPT, which one you will get the quickly answer and why? Which platform you will get the quick answer and why? Okay, let them think this one. I want an answer from them first. You are using ChatGPT and Google for getting the answer of one question. Which one give you a correct answer and why?
ChatGPT, deep learning. ChatGPT.
Yeah. Okay. Why? They said anything? Why?
Oh, Gemini.
Okay, no problem. Any AI models can give you a better result or faster result than Google. Why? Is this a role? Pre-trained transformer, right?
Pre-trained transformer.
Because it has been pre-trained on the basis of the classroom environment. So we have already know about this classroom environment, and then there is educational practice and language education they have used. That's why you are getting the faster result of the result before. Can you like imagine like when you are doing start with your +2 level or bachelor level, the things, the materials you got it back when you ask to Google, and now it's different or not? Sometimes you get it many things what you have asked that is unnecessary things, but when you ask to ChatGPT, it gives you more precise, right? So that is because of this is pre-trained, and that's why you are getting a little bit more precise. So overall ChatGPT, if we can see, improve the academic performance. Agree or disagree? Agree? And
We agree.
effective motivational state that we can do, higher order thinking procrastinates that we can identify, and it reduces the mental effort, so has no significant effect on the self-efficacy. Agree or not? The last point.
There's no significant answer.
Has no significant effect on the self-efficacy. Can you get any significant effect on the self-efficacy with ChatGPT? In your self-efficacy?
No significant.
It can improve your academic performance, perfect, effective motivational state. It will reduce your mental efforts, higher order thinking propensities that will get you. And then finally, but it will not give you any sort of the significant self-efficacy to improve, but you can improve your academic performance with that one.
Yeah.
That is the main role of this AI generative model. So let's see now a little bit, or we will we want to break around 10:30.
Yeah.
10:30 will be okay.
Yeah.
Maybe for 10 minutes or now before I will start machine learning. What do you think, Simidin? Any idea? In our schedule, there is no break, but I'm worried about the student.
Yeah. Any comment from the audience?
Yeah,
ChatGPT
if you
is
want,
my life.
just
Yeah. Any comment?
okay.
Yeah, ChatGPT is my life. And then ChatGPT answer our question directly. We don't have to choose a specific link to get to know the answer. And then ChatGPT is comfortable to use for educational purpose because it provides clear, well-structured explanation, adapt to different levels of understanding, and offers instant feedback. It allows learners to ask questions freely without judgment, explore complex topic in simple language. The receive example that support better comprehension. Its interactive nature makes learning feel more engaging and personalized. ChatGPT effective because it goes straight to the point. Is concise and provides clear conclusion. The answer depend on personal digital report. Agree. Yeah, no soon.
Okay.
Now.
Okay, that's good. Yeah. Okay, that's good. So you have a good understanding now. So I'm trying to make you give you this type of the things that we can integrate together. So are they looking for the breaks or not? No need a break.
Bagaimana peserta? Kita break berapa menit? 5 menit? Yeah, 5 minutes. It's okay.
Okay, yeah, that's good. Yeah. Okay. So we will start after 5 minutes. Yes.
Okay.
Thank you.
Alda, you can play music. Okay. Kita dengerin musik sebentar ya. Mr. Rosan, could I play
Yes.
instrumental for a moment?
Okay, that's okay. Yeah, go
Play,
ahead.
play YouTube.
Yes.
Yeah.
Okay, no problem. Mhm. Shall we start? Okay.
Yeah, I think it's enough. You can continue, Mr. Roshan.
Yeah.
Okay.
Okay. Okay. Let me do one thing. Okay. So let's continue again.
Okay.
How we can use a machine learning model in health and how we can integrate this one. So this is a machine learning model in healthcare are used to analyze a large data set to identify the patterns and how and make the predictions that can improve the patient outcome. So optimize the resource allocation, enhance the operational efficacy, and improve the speed and the accuracy of the physician's works. So this is, we need to understand that what we are trying to use for this all algorithms that we are trying to use it for. So what we're going to look for the machine learning feature for healthcare services that we are looking for, like the smart units or Fitbits, smart watches, that smart care, EMR, that is reduces cost, and then supported through the smart documents, smart reports, discharge note, or we do have the digital tools or AI tools or cloud data systems or so on that we are using. So the pillars of the machine learning for healthcare sectors, what we are doing for like the medical images diagnosis, that is the one we are exactly looking for, drug discovery and manufacturing. Then we have a behavioral modification that we can make some like the artificial, like the machine learning model algorithms that we can use it for the smart health records maybe. So we can use like smart health records means we can try to enroll all those people from the one household that we will have a smart health record that we can predict. Like if they have their father and mother have like hypertension or diabetes, we can predict if their children have like a start with the symptom, any symptoms, and they can report self-reporting and use the self-reporting model that we can predict it, like how many years they might have developed those sort of the symptoms. So that we can do with the machine learning. Clinical trial and research, then we have like the crowdsourced data collections, better radiotherapy that I have already give you some examples. And then another one is outbreak predictions. That is the major where we public health experts that we need to focus on, because this is the prediction model, and then we can use this model for the prediction of the outbreaks, different sort of outbreaks. So there we have a big knowledge on there. We can use the machine learning model in a healthcare setting. So if you can see the predictive model, we can use the logistic regression, that is a decision tree model that we can use it. So logistic regression, LR, like I will give you the figure one. This is the traditional statistics method used for binary classifications has been adopted as a basic like a machine learning model. So this is the basic machine learning model that we can predict it. And then we have a clustering algorithms that the grouping patterns of the population that we can use with like the natural language processing. The machine learning have developed like the effective solution for transforming unstructured health data into the structure set. That approach changes enable like the healthcare practitioners to quickly, like we can do the clustering useful for the handling the outliers that we can use it for. Another one is handling the missing data that we can use the clustering algorithms. So the first algorithm we are trying to use the predictive model. So where in the first one, this is our basics logistic regression model, this one, but we are trying to use it like the input layers, hidden layer, and output layers to predict on the basis of this model. Second is the clustering algorithm model. There we can trying to look for the handling of the outliers. Then we will look for the handling of the missing data, then the scaling data. Then we have like the handling the categorical variables, then performing the data transformations, and then performing the feature selection. So this is the for the clustering data we are using for this machine learning model on the clustering algorithms. Then we have a third algorithms, in the clustering algorithms, that is another one is like the grouping patient population. So how we will do, we will have like the different encoders trainer that is encoding data here. Let me turn on my, this is like the encoders training, then it is a decoder training. So it is the plus patient clustering. And then we will have like the ICU EMR or EHR, what you will say. This is like the modality predictors, ICU stay time predictors. So this is our server, first hospital, second hospital, and this is a 50th hospital. So this is federated learning by the community. So what we can do, we can make the model and then we can predict it of the patient clusterings and the mortality predictions by what ICU stay time predictions. So this is how we can develop with the machine learning algorithm. So we have different algorithms that I am trying to explain you. The third one is natural language processing algorithms. There what we can do, information abstractions that we can useful. Text classification, we will use NLP can categorize the text into the predefined classes. And then we will have like the sentimental analysis for the clinical notes for the understanding the experiences, and predictive modeling or predictive patient outcome, and then the clinical decision support. So this is by the natural language processing, we can predict by the machine learning process. So these are the third one. And then you can see, if you can see here, what we will do one by one. So the first, we will have a data acquisition, then we have electronic health records, and then this is the data file what we have. Second phase, what we will do, text processing to the text cleaning, and then we have a disseminations reduction. Then we have a third phase, we have a feature extraction, then the word embedding, and then cleaning crops. Then we will start the deep learning here, machine learning here by the artificial diagnostic system, predict and classify, and then performance and measure. So this is the language, natural language processing model that we can use it for the machine learning model in healthcare settings. There we can predict them, classify some sort of disease, that we can do it. In the fourth, we can see the reinforcement learning model that is optimizing the treatment pathway. So what we will do, reinforcement learning, machine learning approach, which trains the agent to learn the decision-making strategy or the functions through the continuous interaction with their environment. So we will do like this. So what are we going to look for? If you have the similar example, previous one, ICU stay admission, that is this is in the database. Then we will have like the event of the mechanical ventilations. Then we will look for the processing steps, that is impulsions like the sample and hold. And finally, like we will look for this behavioral policy, that is the AI policy 1, 2, AI policy 3. Then we will have a different algorithms that we have treated. And finally, this is the ICU database where we will identify the final one, like the how many like the ventilator AI policy, that is independent testing. So this is how we can develop, or we can develop like on the basis of drug A, B, and C, what is the input, algorithm, and output that we can generate. So this is a reinforcement learning by machine learning when we are trying to optimize the treatment pathway. So if you have different treatments that we are looking for, so treatment 1, treatment 2, treatment 3 by the drug A, B, and C, and then we are trying to decrease the available model informations, that is decreasing what. So the input is what we are trying to do. This is the input for all the genotype drug pairs. And then we have genotypes, this one, and this is the current fitnesses. And then we have algorithms. This is called the dynamic programming backward instructions. So we look for the deep learning by 2 models. And then our output is true optimal policy mapping, the like the optimal actions drug to each possible state, and predicted the optimal treatment given by the current genotype. And then another one is predicted optimal treatment given by the current fitness and the previous drug. So this is how we have trained and get the details from what we are trying to predict it. Fifth one is like the transformer learning we call, using the pre-trained model in the healthcare setting. So what we will do in healthcare, this is called TL leverage, pre-trained model to improve the performance of the new tasks such as the medical image analysis or the disease prediction or the patient data analyzing by utilizing the knowledge gained from the related tasks. So we have this model. What we're going to look for, if you can see here, we have an image and a net data set. For this, we need supercomputers. So because of we need to store a lot of images at the same time. So we will use like a image net data set, then transform the learning. So pre-trained network we will have, then softmax, then classifications, and after that you will come here to the like the input of the CT scan data set, and then like the retained initial layers of the model, and then we will identify the what it is, the COVID positive or COVID negative. So this is the algorithm. When you will make it, you can, if you can put your database by yourself within a very short time frame and with a very precisely, you can identify or predict your disease. So this is how, this is for this, we need to learn about the machine learning or artificial intelligence or deep learning or decision tree. These are the models that we are trying to look for. So there is another example, like for the medical image analysis, what we will do, like transforming data to data, then small data, multi-stage transformer learning we call here. So we might have a sufficient data or well-generated model, that is a deep learning. We will use this model for generated model. So multi-stage transformer, then we will have a knowledge transformer, that is original task, immediate task, and targeted task. So we will use like the original data, original model, original task, and then we have a immediate data, original model, and immediate task. And this is the model how you can try to the transform learning to pre-trained model in a healthcare setting. So these are some examples. Like now you have a different model that you can, we started with the basic, very basics here. With this model, this is the very basics model, what we're gonna look for, and we did it before. This is a predictive model that we have already used, like a diagnostic logistic regression, that is a like a decision tree, what we did it very simply. But now we have a different algorithms that we can also use for like the grouping patient population. And then we have a different like different model that we can use the natural language processing. We can use the reinforced learning approach, and then we can use the transfer learning approach in the machine learning models. There you can do or look for the different modelings of the different set of the data that we can generalize or classify the data to get the predictions of this, the predictions and the value of the what we are trying to learn. So if you have any question until now, I am very happy to explain you. So I also have your answer. Two questions still remaining from your side that I have to answer. That's I will answer you at last, because I will come to the ethical things and then other things as well about the data modeling or so on. Until now, anything? If you didn't understand anything about the machine learning approach or AI?
Yeah. Only one question.
Yeah.
You can reject technology, but to what extent do you think health worker are ready for this change? I think it's we cannot reject technology. In your opinion, are healthcare workers ready to face the chance? Ready
You
face
think the healthcare
change.
workers are ready for these changes? I
Yeah.
think it's better to be ready for these changes, in my opinion, because we have to now adopt this sort of model because the world is moving. It's not static yet. And now we have this sort of technology that is challenges, of course. We do have some challenges. I will come to the challenges part as well. But I think it should be better to adapt it, and then because let's say why you have turned into the ChatGPT now from the Google, because it's easy for you to understand. easy for you to grab the knowledge right away. Then you have, and you are also looking for like the DeepSeek or maybe some other model, Cloudy AI, we have a Gemini, we have a metadata. So lots of the things that you have moved on it already, but I think it's better to adopt, though we do have some challenges. I will tell you what are the challenges, what are those challenges we are facing it now, but it's better to move on, in my opinion. Okay. Let's go to the next model. We have a big data in a public health data analysis. So what exactly we are talking about the big data in a public health data analysis? Oh, sorry. So, okay, let me. Oh. Okay. So, what do you understand about the big data? Anything? Any understanding? Big means large. More than 1,000 or less than 1,000? Any idea? Okay, I'm getting the answer here. Free data in the cloud. Okay, we usually use the national survey data and the public health data. Okay, that's very good understanding. Okay, I will tell you what exactly we are looking for the big data. So the data analysis, big data analysis in a medicines and healthcare refers to the integration and analysis of the large amount of the complex and heterogeneous data. So that means we are not talking about anymore about the homogeneous data that we have been very much trained to do that, right? We have been trained to go to the community. We do have a one information form, and then we can collect the data as per our requirement to do the research on the basis of the homogeneous community. But now when we are talking about the big data, it's not about the homogeneous community anymore. We are talking about the heterogeneous data, that is genomics, maybe epigenomics, and pharmacogenetics data, biomedical data, telemedicine data, that is the sensor data, medical equipment data, and then electronic health record that we are talking or dealing about the mostly for the big data. So if you can see, this is like the improve personalized care when we can use, boost the healthcare marketing, help predict the health outcome and optimize the growth rate. So the characteristics, we can see this has a 6 characteristics of the big data when we are talking about. We have a values of the big data refers to their coherent analysis, which should be like the valuable to the patient and clinicians. So if that data is no more valuable, we no need to use as a big data. Bolo, the amount of the data should be quite high, that you have already answered me. Like the velocity is the data in the motion as well as to the speed and frequency of the data creation, processing and analysis. Varieties, that is the complexity and heterogeneity of the multiple data set, which can be structured, semi-structured or unstructured. Then we have a veracity, that is the data quality, that is relevance, uncertainty, reliability, and predictive values. And then variability, that is consistency of data over a time. So if we have these 6 characteristics of that data, we can use it as a big data, and we will make the different machine learning algorithms to use this. So if we can talk about the importance, why we need this to real-time insight that we can do with this big data. So capturing the analysis, large amount of data from the hospital and homes in a real time, we can use those things. Precision medicine, we can use for the precision medicine, can transform the medical field into the precision medicine by using the causal reasoning, knowledge, and algorithms. I already explained that you maybe know. For the policy making, policy implications, like the public policy become more accurate because of the policy is product by the government based on the data. So this is the major importance of the big data. That's why we are talking or dealing about the big data. I already mentioned some of the things about the public health data generation and so on. So it refers to the utilization of data set in a health research to identify the patterns, predict the health outcome, and enhance the quality of care through the advanced data analysis. So now our advanced data analysis is machine learning that we are trying to make with the decision tree or neural networks that we are trying to use for the big data. So type and source of the data is primary source of the health data, that is medical service providers. So where you will get, that is your question. So I hope you will get the answer. We will get it from the medical service providers, pharmaceuticals industries, public healthcare organizations, researchers, and the medicine insurance as well. So we will get this data like the for big data. This source are the medical claims, mostly mobile data, wearables. So we can get those data, like these are the personal data, even though you can have accessibility of those data from the different organizations that you can, like the academic research or hospital ESR data. We can also like the opt in the genome registers or government medical claims. There we could identify the big data in a health research. So let's talk about little bit about the type and sources of the data. If you can see in the health research, the major one is EHR, electronic health record. So describing the patient treatment and outcome of the rich but underused information. So most of the EHR data were underused conditions. So that's a traditional healthcare centers capture and store the enormous amount of the data, structured data, but that is not like we have a data for diagnosis, laboratory tests, medications, and then, but we are not exactly using that data in a very precise way. So this is the maybe like we are collecting the data from the EHR, like the source and format. We do have this structured data, and these are the unstructured data. So we can store it like the transforming engine. So now being a graduate of the public health promotion, public health sector, public health graduates, now this is your turn now, because let me say like until now we didn't know about the importance of the big data. That's we had it EHR in all of our medical centers. We do have like a, because even though you did not use the computer-based EHR, electronic medical record system, you have the medical records, right? Because you have a patient data, of course, in the form of the diagnostic or laboratory test, medications, and then the oncology clinical data you do have. But what we need to do now, because being a graduate now and you know about the importance of big data, now your role is to improve the ESR system on the basis of this platform, that we can utilize this big data for the machine learning, and then you can do your research. That is why we are studying this thing. So I think I answered both of your previous question. So where we will get the big data? So mostly electronic health records. There we can get it. Another one is government source. There we can get it. I have two Indonesian students, two or three already. They already did it. The spatial analysis here for their masters. So they got the data from the government sites for the disease data, and all those data, other data from the environmental like side from the GEE. There we get the environmental data set and integrate those data to get the spatial analysis. So this is how we can get the big data for the other source of analysis as well, and you can get the platform of this data to use and analyze. So the another one we can see the genomic data. That's the human genomic, is basically like the foundation of the personalized medicine, which is considered as a next generation of diagnosis and treatment. Life cycle environmental factors and public health. That is we call the climatological data, such as the heat, stress, cold related mortality presents another dimensions of the predictive personal health. Like we can get the all patient, and then we will have like make the conclusion for the experimental treatment or the standard treatment for analysis of the real world data that we can do it. So what we will do, we will monitor the real-time population impact of the human being, connecting the epidemic intelligence with the surveillance, patterns of the social factors, that is bad habits, and then psychological or emotional, and then the stress expressed social media can predict the disease. So these are the data sets, that type and sources of the data you can use as a big data for the modeling. Then another one is social health. That is the major important at the moment. So one of the primary tasks of the telemedicine involves connecting the patient and doctor beyond the clinic. That is the involvement of the social network to new level of the social interactions, which has opened up for the new possibilities, that is patient-to-patient communication regarding the health, beyond the traditional doctor to patient paradigm. So now what you can do, another one to increasing the accessibility or enhancing the public health in the way of the machine learning or the big data method, we can make the possibility to patient communication rather than the doctor to patient paradigm. So we can change it. Why? How? Is it easier? It is possible or not? We can do it by, if you have a one algorithm, that algorithm can help for the similar patient, then they might have, we can increase the patient to patient communications for regardless of the health beyond the transactions. And then another one is wearable devices data. So that is since 2016, the World Health Organization, like the EB 142 by 20 report has highlighted the critical importance of the EM health in public health, particularly for the health monitoring. So that you can also get it from the WHO site. There we have a EM health particular data site to identify all of these data sources. Another one is big data streams consist of the various type of data. Number one is consists of the clinical data, that is biometric data, financial data, that is constituted the full record of the economics, data from the scientific research activities, there you can use it, data provided by the patient, data from the social media. So these are the applications in healthcare. There you can get all those data set, and then you can use as a big data to make the algorithm for the machine learning, and then so on. So another one is public health database, where we can use number one is we can use, like the today use for big data has been shown to improve precision select discipline, like precision characteristics of the public health concern. So that is the one. That is we can use the longitudinal health claims data for the insurance claim and so on, that we can use those sort of data. The second one is secondary use, that is anonymized electronic health record. What is anonymized? Anyone? Why I put this term? I will check your chat. What is anonymized? Okay.
Anonymized.
Any idea? Any wild idea? I used to say wild idea. Anonymize, very simply, we do not have a ethics to use their name or organization, right? Okay. So for ethical purpose, very good. Yeah. So that's why we have to use any sort of the electronic health record data which has not been have a name, place. There we can easily find out the patient. So that is anonymized electrical. That is, we can use it for all sort of the big data. Cohort study data, we can use it like the health surveys and registers. So which registers we can use as a big data for the cohort studies? Maybe we do have a birth registers, we do have a death registers, we do have a marriage registers, and other health service data that we can use as a big data. Environmental variables, so you can use as a NDDI, NDVI. So this is normalized density of drought index, normalized density for vegetation index, normalized density for water index, NTL, nighttime light, and rainfall data that you can get it from the Google Earth Engine. Then we can use some molecular data such as genome, expogenome, microbiomes, and then the transbiome data that you can use it. And also like the mobile phone sensoring data and the self-report that is very useful for the terms of big data and online patient-generated content. So now we have to think like we do have the data. We have a data, but maybe you have a question about the quality of the data, that's for sure. But now your turn to make this quality, that I will say. I will just give this responsibility to all of the graduates, public health graduates now, because now you understand the importance of the big data and how we can use to predict, how we can use to get the health promotion, health activities in a very like effective way. So there we have to look for how we can try for this big data. So this is the overall picture of the type and sources of the data that we can use it, and we can identify very simply. We can use like the heart rate, blood oxygen level, breathing rates, muscle electronic activity, electrical activities, then cognitive functions, movement patterns, sweat analysis, stress analysis. You can visualize the screen time for the student for the mental health, like maybe more than 2 hours if they are using a social media. You can look for their mental possibilities, if they are, which platform they are using, because some algorithms is already modified even in the social media. If you can see why we are getting the similar sort of the things what we think in the social media, because if you expend more than 30 seconds of the one content, you will get the similar repeated content, right? So that is the algorithm that they have made it. So we have to analyze all sort of the things in terms of the big data, and then we can get the results. So if you can see here the public health database, what we can do. So like the sensing the data, optics data, that's electronic health data, public health records, and clinical data. So this is our data warehouse where we can do the analytics with the descriptive, diagnostic, predictive, and prescriptive data analysis that we can use to finally improve the outcome, is the smarter and cost-effective decisions. So this is how we can integrate it, all those things in public health analysis for the big data. So this is the method we can use it, and I already mentioned you about how we can integrate big data to the machine learning algorithms. There we can get the very cost-effective model, and we can predict in very good time frame. Any question until now?
One
Or
question.
clear? Yes.
Is there any organization that provides a kind of public health related database?
Yes. So yeah, I will tell you, it is very easier for you for Indonesia. I think you can get it from the government. That's for sure, the provincial or the central government. There you can look for the census. There is a lots of data in your census, population census. You have a demographic health survey. There you can get it, and then different control program of the health program. There you can get the big data, like for the tuberculosis. So you can get all the tuberculosis data from the DOS center, and this is accumulated to the National Tuberculosis Center. So you can get from that data from the easily, or HIV data. You can get it from so the national centers has the accessibility of the big data. There you can get the data for the all provinces and so on. And then mostly we are using the Google Earth engine for the environmental data. So we can capture the real-time data on, I will tell you in the spatial analysis how we can do for the real-time data generation. That I give you an example for the NDDI, NDVI, NDWI, the nighttime light, and then the lots of we can get for the NO2, CO2, and then the relationship with the disease that we can see it. So we do have a data sources. And then EHR, of course. So for the EHR, you need to develop the good platform. There we can get it. Annual reports, you can get the data. WHO site, you can get the lots of metadata. World Bank, you can get it. CIA, you can get it, all sort of the data. So just try to find out. I think you will be able to find all those data sources in a very good platform. Try to get who.int, and then the data, you will get the metadata of all of the countries. CIA also have, but it is better to use your own country database from the government, Ministry of Health. There you can find out those data. Yeah. Okay. Okay, let me move a little bit further now for the spatial analysis in a public health using big data, how we will do that. Today is a very, I'm just giving you a concept only, because if we can reach the spatial analysis, it will take another 4 or 5 days to do all those things. So I will just give you an initial concept like what we can do. So if we are talking about the spatial analysis, this is a process of examining the locations, attributes. So locations means whatever we are doing in the traditional statistics, what we are trying to do, we are trying to use only with the patients and their outcome, right? That we are trying to do it. But now what we are thinking now, it is depend upon the location. Maybe that there should be the different aspect, the different values, or different probability of being people or being the clusters of that disease. So in spatial analysis, what we're going to look for the locations and attributes and the relations of the feature in the spatial data through the overlay and analytical techniques in order to address the question or gain the useful knowledge of that questions, that how we can do like. So this is like the extract or create a new information from the spatial data. So what we have is spatial data. Number one is we need to have a information from the locations. Means what? Means your province, how many people has been affected from your province. So that geography, that particular coordinates, we call the coordinates, so geo coordinates. So how many people are there, and how many infected people are there that can lead to another province to be infected, that we are predicting, of course, with this spatial analysis learning. So and then we are generating the new informations from this spatial data. So let's see, we have a 7 V's of the geographical big data as well. When we are talking about the big data, I talk about the 6 V's, but now we have a 7 V's of the spatial big data that we can start with. We have a varieties, that is structured, semi-structured, and unstructured data we might have. Then the velocity is batch, real, near, streams, and values. We have a statistical event, correlations, or hypothetical. Then we have a versatile. We have a various sectors, that is the convergence. And then we have a visualizations, maybe transforming result, expertiveness, and like the geo data. And then we have a veracity is the trustworthy, authenticity or availability, then accountability. And for the volume, we do have maybe the terabytes recorded, that is like the transcribed tables and file. So these are the forms of the different characteristics that we need for the spatial data to reanalyze and get the new informations for the different aspects of that analysis that we are talking about. So if you can see the spatial big data that we are doing with the remote sensing or the Google observations, we call the Earth observations. So big data, that is geospatial big data, GIS big data, are the synonyms with the spatial big data. That is 80% of the data of the geographical feature. That is like so the large part of the data in the world can be geo-referenced, which indicates the importance of the processing massive geospatial data that we can identify. So most of the data comes from the Earth observations, that is the big data, and 80% nearly the geographical features that we might have. So what exactly we will do it with the cloud computing helps spatial big data. So we can look for maybe the phone we have, different satellites, different GIS and GPS, so social media, and these platforms that we will have like the volume, velocity, variety, and veracity that we will look for archiving or management. Then we will have like the urban planning, climate change, climate science data, geospatial domains. We do have like the social science, environmental science, smart cities data, land coverage area, geoinformatics, model simulations, and then we will try to get on demand self-service, so measured service and broad network access, rapid data, research pooling, and then the value of the better for this one for the decision support, research publication, and then the operational optimization. So there we have possibilities of all those sort of the platform of the data that we can cover the cloud cover data. So mostly what we will do, like the Earth Engine code editor we have, then we have a third-party web application. Then we have a client libraries, that is from the JavaScript or Python you can use. So wave reset APIs we can use on the, if I can see the Google Earth Engine. So like a geospatial big data processing and visualization cloud platform that is launched by the Google in 2010 as a like the prosperity system. So you can go like the currently free service for the small and medium workloads. So this platform is built to set the technology available for the Google infrastructure. So you will get the data restore and different tile restore, serve, asset, and so on. So if you want to do the spatial analysis, so you can use the Google Earth Engine to get those data from the Earth Engine code editor. So you can go to the Google Earth Engine, register yourself. It is a free of cost. You no need to pay for anything. The beauty of the, if I can say, the beauty of the spatial analysis or big data analysis is you have to only expand to get your knowledge. No need to expend much to get your data. So that is how. But again, you need to like emphasize, or you need to give your potential to justify or verify that data. So potential, in a summary, you need your good thinking or realization than that of the money expended to get the data. So this is the beauty of what we can generate it. So there is a, like we have a different sort of the data. We can get it from the uh, Google Earth Engine. Like we can have already explained you about the water, crop mapping, forest mapping, land cover use, climate change data, data processing, this urban soil, other and disaster data. So we can do the habitat mapping, geospatial analysis, archaeology analysis, nuclear non-proliferations, mine mapping. We can use some different sort of the cloud detections and so on from this big data, and then you can integrate it to the spatial analysis for further detections and analysis of all sort of the things. So Google Earth Engine has a public data set including more than 40 years of the historical map and significant data set updated in the enriched daily. So if you can see, until now, we have a 2024, 2025, some data already available for 2025 as well, but major data is 2024, and they are getting every day. So that is the most beauty thing, that you will get the real-time data, and then you can generalize this with the different sort of analysis that I told you. You can use the spatial analysis, you can use the machine learning, you can use AI modeling by the decision tree, or you can use the CNN, RNN to integrate those sort of things to make the some algorithms that you can use it further for analysis, for research, or so on, that we have a lot of chances. So big data in a road use in public health, what we can do, the transportation is a key component for the urban design for the cities, efficiency and residents' life quality. GIS has capability of handling the data management and model design and scientific decision making for the transportation studies. So that's it is a roadmap for that we can use for the big data for the different issues. So if you can see here, this is a geographical information system and the transportation, so how we can use this spatial database for the optimization and networking, spatial analysis, and spatial devices. So these are the things we can optimize or rule out, like the what sort of things is going on, or what of sort of the spatial temporal traffic analysis. I'll give you one example of the analysis of the big data analysis, that is integrated spatial implications, that is integrated new computer application, spatial method, data management strategies to tackle the spatial big opportunities, and then applications. So what you will use for it, allow you to accurate computing the patient travel behavior to the hospital, highlight the significant spatial data in understanding the healthcare dynamics. So here you can see we can use different algorithms. There we can, like this is a network distance from the cases, and then we can identify like what's network distance cases for kilometers. So this is a number of hospital cases, a number of beds, then we have a number of hospital bed cases, number of bed of the cases, and then we can identify, okay, we can predict it, we do have a sufficient number of bed for those patients who are coming from the 5 kilometer, 10 kilometer, 15 or 20 kilometer, or more than 30 kilometers. So there we can do the accurate computations by using the big data in the spatial analysis. Another one is measuring the population exposure to the air pollution. So you can get the air pollution data, and then you can use the crucial quantifying the risks for the public health, utilizing big data analysis framework to model like the residents stay in the communities, or travel exposures, maybe outdoor PM 2.5 evaluator environment, and lots of things. If you can see here, this is from the study from Beijing. So they have tried to identify the clusters. So the different clusters, like the travel distance and kilometers. So this is a commute, this is a travel exposures with the PM 2.5, and these are the things that they have identified. So this is the beauty, that you can use it, the big data, for the spatial analysis. I will give you, this is a one recently published, my article is from the Nepal. So what we did it in this one is very easily, we try to use, sorry, let me a little bit here. So what we do, we try to do with the RTA fatality rate, so identifying the 4 years data. So we try to make these clusters, the different clusters of the different RTA, and then the major injuries and the minor injuries. So we try to locate which part of the clusters has a more severe and significant RTAs and why. So this is a road network. So if we have a district road network or the federal network or highway and other road network, so how this road network has an impact on the accident and on the RTA, and in terms of not only the injuries, in terms of the death as well. So if you can see here, this is a very interesting, like if you can see here, this part, there is no highway, federal road, district road. So there is some other roads only. And if you can see here, all the years in 2019, 20, there are in this part of the area is a major accidents, and that those accidents converted into the fatality. So no more major injury, even that comes to the fatality, because even though there is an accident, they doesn't have a road to come to the accessible place like this, where you can get the treated as well. So this is how we can integrate the big data into the spatial analysis, and you can publish it in a very high quality journal. And I'll give you one example at last, like how the publication can impact on this sort of analysis. Okay. Any question for the spatial analysis and the big data until now? Okay,
Yeah.
one maybe.
Yeah, is from Zara. So yeah, I use Google data search to see the healthy lifestyle trends before, during, post COVID, and analyze by time series comparison regression using joint point regression. From your experience, is there any practical analysis using Google search today?
I think you can, if you have a data and you have already got that one, you can use the spatial analysis, spatial time series analysis to get the further details of those things. It will be better. How many years data you have? 5 years. Yes, you can. Yeah, you can do for the spatial panel regression. Yeah, that will be perfect. You can try to do that one, spatial analysis, by using the geoda. So you can use the geoda to look. First, you can look for the clusters. Where is the measure that you have looked for? And then you can do the time series analysis. So I think, yeah, you can use that part is the better. And then I think whenever you have a data is the most important thing right now. If you have a data, we have a lots of model that you can use it. Even like you can use the spatial analysis and then predict like the clusters, and then by the models I first. And then also you can use that one with the Python or R program, that you can look for the decision tree and then accuracy of the model, or maybe you can also use logistic regression model. But I think better for this part of the 5-year data, I think spatial analysis will be perfect to use it. Okay.
Yeah.
So we have a very less time now. Let me go with the bigger things like the challenges in AI and ML, machine learning implementation. So we do not have everything good, but we have lots of challenges as well that we have to tackle with when we are trying to deal with the machine learning experiences. So let me explain you a little bit about what are the challenges that we are trying to do. So the most basic challenge that we have is transforming the healthcare using the AI is not a trivial task. It is required of various stakeholders to come together to resolve the ethical concerns before it reaches the climate setting. So clinical setting. So because this is the much important, and that's your question before. So this we need to do like the clinical application. So what artificial intelligence, what we can do, maybe we can do the doctors, we have to do the integrated approach. So this is the major challenges. So because we need like the doctor, patient, public, scientists, maybe vendors, lawyer, regulations, ethics, the embedders, and the engineer software. So this is one of the major challenges that it has integrated with the artificial intelligence or machine learning implementation. So there we need to very careful about the data governance. algorithms that we have made it, and then that algorithm should have like the attack or bias or explanatory ability or transparency that we need to discuss with, and then patient consents, data management infrastructure. So mostly for this, what we will do, we have to look for our ethical concerns, and then we have to look for the various stakeholders meeting that we can resolve this sort of the things, this sort of the challenges when we will come to the machine learning process. So there is the issue of the data privacy and security, of course. So protecting the patient information, that is an enormous concern regarding the data privacy, especially when the data required for the artificial intelligence training encoders, that is sensitive and confidential data that we need to add it. So any leakage and the misuse of the data for any sort of the cloud, like the result in the massive damages for the patient, healthcare providers, and the software vendors. So AI healthcare, like we can do the surprising performance, data privacy, and security concern. So this we need to include by the, like we can start with the ethical things that we have to look for, privacy and utility, security things, confidentiality and integrity that we have to maintain. Robustness of the data is very important. Legality. So whenever we will try to make the algorithm, it is better to integrate all sectors, to integrate all sectors where you have to generate the data and where it will be applicable. The both thing is you have to keep in your mind first, and then we have to involve all sectors people there. How can we overcome this sort of challenges? That is a major challenges that will arise into the machine learning. The another one is bias in the AI algorithm, that is addressing the disparities and healthcare. So what we have to do, like AI can in traditionally, like we can exist a bias and healthcare data leading to the disparities in the treatment and outcome. So for this we have to look for the formulating the research problem. So and then we have to look for the ethical bias or general bias, age bias, maybe the disability bias. We might have the global misrepresentations bias. So we have to focus on all those things, all those 5 areas. So we have to look for the formulating research problems, data collections, data pre-processing, model development and validations, and model implementation. So all those part, being a public health graduates and then being a developer of the many sort of the AI or machine learning implementation, we have to think these are the places where we will have the bias. And there we have to integrate in a very good way that we can make the machine learning pipelines in a very good model that you can get it without having the bias. We might have the integration with the existing system that is called the interoperability changes. You might have these challenges. So we might have like the multi-faceted, we call the challenges involving the strategies in like IoT. So the integrated that is the data integrations part, technology hunters such as the heterogeneity of the device and standard, scalability issue. Maybe sometime we might have the pressing need of the standardization regulatory. So these are the things. Maybe it will come as a challenges, but we need to solve the challenges for the machine learning part. Another one is high cost for the AI adoption. This is a very important part. So the investment in infrastructure, we need to develop the investment a little bit more than the regular what we did it. So maybe we might have the financial estimations are complicated by dynamic cost, maybe the continued evolvement of the machine learning technology platforms. So the initial cost to develop the model, and then maybe in the real world model and the end user training for the geo life. So these 3 things are the major challenges that we have to face during the machine learning model that we can do it. So this is the performance, like what we can do it. So these are the opportunities. If you can see the performance, resource efficacy, time, support assistant, best practice standards, half of, I can say, like transparency, traceability, interoperability. But the challenges is the fear, that is the trustworthiness, acceptability, data availability, resources, infrastructure, sensitive data, legislative, and then the regulatory policy and ethics. So these are the things that we can see, like should be the challenges for the machine learning, but we have a lots of things that we can get it. Time is the most important. Supportive assistant, we will get it. Best practice standards, now we can do it. Transparency, we have traceability, interoperability, that is depend upon the researcher, that how you are trying to integrate this machine learning model to the real life scenario. So this is how we can do that. Another one is high cost, of course. So maybe we can like the element of the healthcare cost that we can integrate with the machine learning model monitoring or automated restructuring system. So these are some high cost. We will have the adaptability, but initially we no need to look for these are the infrastructure and so on. The another one is most important for all of us is ethical consideration. So informed consent for AI driven decision making, that we can do it. Like the AI technology have the potential to revolutionize how healthcare delivered, offering the innovative solutions. So this we can look for. And ethical concern adapting to AI are that's mostly the individual rights, protection, patient data, and adhering to the principle biomedical ethics. So the one good thing is for the big data, we are mostly not looking for the individual data one by one. So it will be easier for us to get the ethical concerns as ethical assumptions research we call. For the spatial analysis also, we are trying to get the ethical assumption research. There were no need to rush a lot, no need to all the meet all the patient and so on, that you can have a lots of ethical concerns. So if you have the data like the electronic health record data, and that is anonymized, that you no need to work for. So you can apply the ethical assumption research in your IRB, institutional review board, that you can get it, and then you can analyze that data. So this is how, though we have an ethical concern, of course, that is one of the challenges I can say. So we do have like the regulation, privacy, and mitigation bias, transparency, relevance. So these are the things that we can integrate for the government confidentiality and accuracy. So let me talk about a little bit about the global impact of the AI in healthcare, like we are expending this much 2.5 hours to know about all those things, to bridging the healthcare gaps, such as like the expanding access to the rural areas. So AI technology will dramatically improve the efficiency and the quality of healthcare services in a rural area. Understand the reach of understand the reverse area, training healthcare worker AI, like the magnetic shortage of the qualified healthcare providers. Let me give you one example. If we can make the one algorithm for the AI, which can help you to improve the competency or compliance of the hypertensive drug. So if you have developed one algorithm for that, and then you can send that algorithm to the remote area, that you can give, or you can train the let's say lower medical health providers, that can give them, or that can improve the quality of the lots of the prevent the hypertension on that sort of community. So that is how we are trying to bridging the healthcare gaps by this modeling, by this AI algorithms that we have trying to develop. So artificial intelligence for accessing to the primary healthcare in a rural setting. That is the major role of this part, that we are expending our time, we are expending our energy to use this model and to learn about this particular part to do that. The another one is pandemic preparedness. That is again the most important part, and we have already faced one of the pandemics that we have already did it. So we can do the AI driven forecasting and monitoring the pandemic preparedness. That is the another model we can develop. So maybe we have the medical actions, tracking actions, we can do detection, maybe the social dynamics detection, health, maybe the disease detections, that we can use it as a pandemic preparedness. So this is the another beauty of that, we can use it. Another one is addressing the aging population. Nowadays, even in Indonesia or in Thailand, we have now a problem of the aging population, and it is very risky to take that aging population to the health sector. That I already give you an example of during the COVID time. If you have a very normal conditions, and if you have only like some sort of the problem to check the blood pressure, could you go to the hospital or not? With the aging population, no, right? The answer should be no. So on that cases, the AI will help you for the earlier care, for the chronic disease management. We can make different sort of the algorithms, like for AI pivotal, transforming elderly healthcare by enabling the better management of the chronic disease through the predictive analysis and personalized care plans. So AI-driven digital transformations in the healthcare is crucial to meeting the growing demands for an aging population, offering the solution that traditional healthcare service suggested to provide. So that is how we can do that. The another one is public health surveillance. There we can use is real-time disease outbreak detection. So there is maybe the like the warnings, trend predictions, public health response monitoring. So this is how we can use the deep learning, reinforcement learning, knowledge graphs, Bayesian network, and multi-grade system, that is public health surveillance report system, to extend the data source, data analytics, and then epidemic monitoring and simulations, where we can do the agent-based monitoring, multi-agent simulations, response assessment as well. So these are some global impact that we have to look for how we can go with this one. So AI incentive worldwide, what we can do, digital data interventions can enhance the population health. That is, AI can provide the powerful tool to automate tasks and support the informed clinicians, epidemiologists, policymakers. There we can use everything like the quality of the universal health coverage, better response to emergencies, in the future thoughts for the AI modeling or so on that we can do with this. So basically, if we can say, like, all of this, our knowledge is for the digitalization, right? There we are trying to analyze or trying to focus with. So the technical is a process of the converting existing along record to the digital health that we are doing to digitalization, involve organizational and the cultural changes to include and maintain the technology in the process of service delivery to meet the stabilized public health goal. That is the measure. And finally, what we are trying to do, the digital transformations, is a complex and a multifaceted process that is disrupt and fundamentally change the culture, operational model, and goal for public health services centered on the health need of the public. So these are the things we are trying to look for to reach with these algorithms that we have expanded. And then the benefit and challenges, if you can see here, this is the improved access to healthcare, right? But finally, what we will look for, what we will do for all those things to improve, of course, access to the healthcare, early detection and rapid response, better patient outcome, improve the public health outcome. That is the major benefits what we will get from this is called the big data set or AI or machine learning or spatial analysis that we can do. Though we will have some challenge as well, like the data privacy, security, of course, digital divide, quality of data, and then cost, of course. But even though we can use this for a lot of digitalization, a lot of things that we can make it better. So if you can see here the challenges and need to clear terms of the future, if you can see the focus on area of the future, clear terms, collaborations, population health approach, there we can do sustainable system, complications and consents, shared decision making, maybe the patient advocacy we can do, patient empowerment, technological adaptations, then maybe the interoperability, and then the emerging technology then we can use for this sort of the challenges that we can move for. Okay, anything? It's good. So what we will do now, next, future directions of AI of public health, what we will try. Now this is our role. Now we already know about the importance of how we have to look for. So the future direction, if you can see, this is a very good way to do that is the collaboration. Now we have to, this is the time to collaborate with the stakeholders of clinicians, researcher, ethics, and then the policymaker for the adjusting the ethical principle and the patient-centered care. So how we can do this? And we have to make them, educate them or advocate them on this basis, like how we will use our knowledge on our patient, our way to use for the big data, for the machine learning and so on. Then we can advocate for the investment in AI educations and training for healthcare professionals. So why we need this one? Because we can very easily train the remote healthcare worker. We can monitor the remote healthcare workers. We can provide, we can focus on the bigger areas and then we can provide lots of ideas on that bigger areas. We can generate those sort of the algorithms that can prevent a lots of people on that particular part, and the development of the implementation of standardized ethical framework and guidelines. So this is also very much necessary, that we need to develop a very good standardized ethical framework which can guide all of us to use the big data, to generate the big data. I will say start with the generate the big data, use the big data, identify and predict the machine learning models that we are trying to develop it, and then we can test those algorithms for better prediction of the any sort of disease, and we can leads to the all sort of the AI in the global, which I show you like the 5 major area that we can use those things for the improvement, being a public health graduate. So we can do like with the feeder learning for the data sharing, we call the feeder learning, allow multiple instructions to collaboratively train AI model without doing anything. Then we have a explainable and a transparent AI, that is the future of the AI in healthcare, must prioritize and interpretability so that the clinicians can understand and trust the machine decisions that we can do. The another one is integrative AI platforms that we can use. That is the next generation of AI system will combine real-time EHR, electronic health records data, wearable sensor data, and the geometric data, and then the social daily trends of the data to provide the comprehensive care recommendations that we can also do in the future directions. AI in mental health and neurology is very important now. So AI is like expanding into the mental health with the vocal and facial emotions recognition. Maybe we have to train tool assessing like the depression, anxiety, that is a major problem, and neurodegenerative disease in earlier stages. And for the also for the like the global health, we can see like global health pandemic response, that is AI tool will become a center for infectious disease modeling. So when we will do like the infectious disease modeling, we will also use the prediction model by using R program. So where we can look for, like if you have a dengue at the moment, it's very much that we can predict it like within 7 days or within a month, where we will be the major clusters of the dengue by using the machine learning model now. And then the precision accuracy as well, we can test it with the decision tree by what sort of things you have nearby will give you how much accuracy with those sort of the modeling. Vaccine distributions also you can use is logistic real time. Public health surveillance, of course, critical, and for future pandemic preparedness that we can look and predict for with this AI modulations, and then the training by the machine learning model. So these are the things now. This is the things we have to do it for our sake. And then let's say this is our time to extend our speed in the digital is meaningless if you are running in the wrong direction. That is by Bill Gates. So now we have to speeding ourselves for the digital phenomena, that we can achieve it through it, our sharing knowledge by the integrating our knowledge into the all sort of things that we can use it for the research and future directions. So that's much from my slide. Thank you so much. If you have any question, I'm very happy to help you as much as I can. Yeah.
Yeah, one can. There are many weaknesses of big data. For your experience, how you minimize error when using big data?
Yeah. Okay. I will stop my slide sharing, and then I'll discuss with these things. Yes, there are errors of the big data. So now we already know about the importance of big data. That's I already explained you on the very, this is the long 2.5 hour, around 3 hour class, that what is the important. Before it is very difficult to know about, or the people do not know much of the importance of big data. So that is the one of the reason that we have a problem. But now what we can do, so you have to start collecting your data on the basis of how you utilize it. I have a very good experience that I have worked with one of the hospital before as administrative chief in Nepal. what I did, we have started with the EMR, and what we did, because I know my research background is I can utilize my big data, like let's say I can utilize the hospital data of all of the laboratory data of the patient, maybe like a cohort study. I can just use as like the one patient can come in like 3 months for HbA1c. I will look for their data for 5 years. So now I know the quality of data what we need. And then being a graduate, we have to fix that sort of the variables in the database management system that you can utilize it. So now, until now, it is on the basis of clinicians only, but now we are being the public health professionals and then knowing the importance of big data where we can use it. Now, even though there is a weaknesses, if we can try, we will get it. There's no problem. For the GE data that I mentioned you about the Google Earth Engine, you can get the real-time data. There is not much difficult and not much many limitations, but the limitations is within the data collection system or data management system. So we need to improve our data management system. There we can utilize our big data in terms of the different sectors. So we have to sensitize this issue with the government sectors to how to utilize our management of the big data, because there is so much importance of this big data that we can use it for the research and then the further prediction projects. So we have to like integrate some system into the EHR, or you can use the better electronic medical record system in the hospital settings or different public health settings. There you can generate the data in a good quality level. Yeah.
Okay, thank you very much. Ladies and gentlemen, is there any question again to Mr. Rozan Kumar Mahato? Yeah, I remember. Still one question from Miss Nurahma. How do I get permission to use data
Okay.
on social media platform like Instagram,
Yeah.
such as common data?
Yes. Okay.
What
So
about
for
ethical
this,
clearance? Is it required? Yeah. Okay.
yes. Yes. So for the ethical clearance, of course, it is required, because without ethical clearance, you cannot use it. But the second thing is for the social media data. Now, I think there is a platform of the government. They have a like the permission, like whenever like you are using a Meta or TikTok format anywhere, the data from the social media has been come with the government permission, so you can get that, but after only the IRB, and then we can get it anonymous data. So what you can get the data from there, like maybe you can maybe develop some, because what we are doing here in Thailand, we had experience. We did 2 or 3 research where we use the social media like TikTok. We make an algorithm, behavioral change algorithm, to enhance the one is like to enhance the vaccine efficacy of the vaccine adaptability of the COVID-19 vaccine. So during that time, you make the algorithms to provide, and then we get the permission from the provincial government to use the algorithm feed into the social media TikTok. Via TikTok, we tried we trained all of the community health volunteers. There we can train them. So you can get you need to do the ethical, but you can do the ethical exemption research because you are using the big data. We cannot get the single one by one data, but you can get the data from the provincial level, district level, county level, and then you can use that platform, social media platform, to use maybe a data of the screen time. You can use the data of the behavioral change modifications, communications data, or all other algorithms that you can try to get it. Yeah.
Okay. Thank you very much. Audience, is there any question again? Please raise your hand.
Yes.
Yeah.
Yes. Go ahead.
Miss Lintang Kemuning. Okay. Lintang Kemuning, please unmute your microphone.
Okay, thank you, Mr. Samsul. Good
Yeah.
morning, Professor. My name is Nintan. I start a student of the Master of Health Promotion Program at Diponegoro University. And firstly, thank you very much for your excellent presentation. I would like to ask, how do Nepal or Thailand plan to overcome the possible challenges in the future related to digital technology in health promotion?
Yeah, right. Thank you so much for this. Is a very good question. Actually, this is really an issue that we need to focus on. So the first thing, of course, optimization is one of the better option that we have to look for the one way to solve all those issues. So mostly the government sector that we are trying to using the digital platform that can have like the one hub, and then uh, because of the privacy and the data security as well, we need to monitor for those sort of things like the security issue as well. So we are trying to, like at the moment, if you have heard about or not, I'm not sure, DSIS2 is using all of the world. So now there we have a one platform for all those digital data. We are trying to do it, but other data also we need to have a single platform that we can integrate together, will be easier for us, and then we can get the permission from the similar sources where we need to use it for the research or any other purposes. That will be better option, yeah, of course. So, but we need to, yeah, focus on lots of the government even focusing for the social media data as well as the health data, of course. So now at the moment is the DSIS2, and maybe we might have any other platform as well to integrate all those sort of data. And then, of course, there's surveillance data is going on. So I think we do have a challenge, but if we can integrate with the one scale system, one road policy from the Ministry of Public Health, I think that's perfect idea to use that.
Yeah.
Yeah.
Any other questions? Oh, no other question.
I hope
Yeah.
they understand. Yeah.
Yeah. Thank you very much. Time has passed so quickly. Yeah.
Yeah.
Ladies and gentlemen, what engaging and insightful session we have just experienced. It was so enjoyable that we almost lost track of time. From what we call big data, artificial intelligence, machine learning, yeah, until to the use of spatial analysis and on GIS, yeah. We have learned so many valuable things from Associate Professor Dr. Rosan Kumar Mahato. I believe that in one way or another, all of us have gained new knowledge that will enrich our understanding of digital platform, especially big data analysis and the digital world of AI, yeah, in public health, especially in health promotion. On behalf the Master of Health Promotion Program and the Faculty of Public Health Universitas Diponegoro, I'd like to extend our heartfelt gratitude to Associate Professor Dr. Rosan Kumar Mahato for sharing the experience with our student, lecturer, and alumni. Yeah, please do not hesitate if in the future we invite you again to be part of our learning journey. Thank you very much, Professor Rosan.
Thank you.
That concludes my role of moderator as moderator for this session. Now I return time to our Master of Ceremony, Mbak Ada Azika. Again, thank you very much, Mr. Rosan.
Thank you.
Yeah, thank you, Mr. Syamsul Huda. Yeah, thank you very much, Associate Professor Dr. Roshan Kumar Mahato, for the wonderful and insightful presentation. Your talk has given us valuable knowledge and new perspective on how big data and artificial intelligence can be applied in health promotion or biostatistics. Personally, I'm very interested in how big data can be utilized to design appropriate intervention, especially to deliver health promotion that is more targeted and effective. We truly appreciate your time and effort in sharing this with us today. Before we close, I would like to thank you, Bapak Dr. Syamsul Huda, for serving as today's moderator. And once again, thank you very much to Associate Professor Dr. Roshan Kumar Mahato for the alignment about utilization of big data analysis and artificial intelligence in health promotion. I think we have a lot new perspective and insight. And thank you all participants for joining today event. Before we close, let's take a group photo together. We kindly ask all participants, both on-site and online, to turn on your camera so we can capture this moment. Please to turn on your cameras. Okay. Oke. Kita tunggu dulu teman-teman yang lain untuk buka kamera.
Mhm. Cukup.
Oke. Mungkin saya hitung ya. Ready? 1, 2, 3. Once again. 1, 2, 3. Okay, thank you all participants for joining today's event. I apologize for any mistake in my words or action during this event. Assalamualaikum warahmatullahi wabarakatuh. Have a wonderful day.
Waalaikumsalam, Kak. Thank you, Mr. Rozan. See you
Thank
next.
you. Thank you. See you next. Thank you.
Yeah. Pak Geo, saya kira Geo Fasna.
Selamat siang, Pak. Pak Samsul. Pak,
Berpun Mbak Rina.
Bapak bisa dimintakan tolong ini Pak materinya yang tadi Bapak.
Bisa. Nggih.
Matur nuwun Pak.